Hello everybody, I'm Victoria Sprigg and I'm delighted to introduce Katie's Swedish back massage with percussion techniques and their sounds. Please watch to the end to see some hacking and cupping. Please subscribe to see the rest of Katie's Swedish massage. Let's spread a little healing. So here I am introducing some beautiful carrier and essential oils to Katie's back. This starts her whole body massage that she has booked today. She's actually going skiing in a couple of weeks and she wanted her body to be as fit as possible, ready for the assault up the Alps. So I am introducing the gorgeous evening primrose and organic sunflower oil, which I have mixed with some clove bud, sweet marjoram, cinnamon and mandarin essential oils. It's quite a Christmassy mix. We tested them first with my kinesiology techniques to check that these oils are correct for her today. And I start with a whole back effleurage, working firmly up each side of the spine and softly bringing my hands around the sides and down the back to the sacrum. The most important thing here is that I am encompassing the whole back. My hands work firmly up, around the shoulders, down the sides. And I like to include the whole back, the edges, the tops, the sides, all of the muscles. This includes the latissimus dorsi, the obliques, the teres major and minor, the trapezius, the deltoids, and of course the top of the gluteals. Katie and I are having a little chat at this point. I'm telling her which oils have gone into the mix, the fact that they are a gorgeous orangey colour because they include mandarin essential oil, which is giving her a beautiful natural skin tone, lovely and tanned, ready to go skiing. And you notice my orientation has now changed slightly, my posture. I was applying a little more pressure. So a Swedish massage is different from aromatherapy in that it tends to be a little deeper. It can be a little faster sometimes, but only once the body is ready. I start off with slower speed and technique in order to acclimatize the body, the nervous system, ready for a deeper massage. I now have a double-handed approach where my fingertips are pointing in the direction of the flow. This is called a figure of 8 technique. You may have seen it in previous massage videos, for instance on Befar's massage in the early days of this channel. A few months ago, back in March, I posted those. And now I've got my thumbs separated. They're working over the center point of the diamond shape of the trapezius muscle, either side of the neck. This is quite a sensitive area to be massaged. I always work sensitively here because it can be quite sore. And I always think it's much better to go in slowly Warm the muscle first before applying too much pressure or too much speed. And now I'm overlapping my hands in a circular effect around the scapula. I started with my fingers, then the thenar muscle of the base of my hands, and now look, I'm using my forearms, which can be a Swedish massage technique, not every time, it's optional. So using the forearm muscle and occasionally bringing in the elbow point around the edge, here we are, around the edge of the scapula. This is a really beautiful technique to receive, but it can be a little sensitive and sore there, a little tender. So best used very carefully. Always check medical history and always asking the client how it feels. I'm using the arm in order to work on the scapula, the shoulder blade, by separating the scapula away from the spine, pulling it a little, a nice stretch. And now I'm using my fingertips, in fact my fingertip pads, in order to massage on that flat bone of the scapula. And now working with my hand, one hand on the scapula, the other hand supporting the upper arm with my left hand cupping underneath the shoulder. That has the effect of rotating, massaging in a circular motion over that scapula. It's great to separate that bone like we try to in yoga. Now alternating hands, having worked on the toxins, just to clear them away down to the axillary lymph node underneath the armpit. Now repeating the same moves on the other side, working in a circular effect around and on the scapula. Having worked with my fingertips and then the base of my hand, now moving on to the forearm, using the muscle so that it's flesh to flesh, working the forearm around the scapula, always asking the client if that feels okay. And once the area has been warmed, and you can tell by the colouring, the skin tone on and around this area, then bringing my forearm up to work with the elbow point. I'm supporting the scapula with my right hand while working in a mini circular motion around the whole circle of the scapula. And once I feel like I've agitated those toxins that like sitting around and on the flat bone of the scapula, I then clear them away with a whole hand massage. You can see well in this video how I use the arm to work on the scapula. So I've got my right arm underneath her upper arm and shoulder point. Meanwhile, my left hand fingers are agitating the scapula by shifting those toxins. I've got my fingers separated. It's almost like drawing a cross panel on the scapula and then seeing in your mind's eye the little squares created by that cross panel, and then massaging with the separated fingers into each square, and then shifting them away with whole hand, overlapping, alternating down to the axillary lymph nodes. It's great to use the arms on the upper back and scapula, even it works on the upper spine. And now, with a little more oil, as Katie's back has presented as quite dry, she needs more carrier oil and essential oil to work, hydrate and moisturize. I'm actually standing at the top of the couch here, which isn't a normal place to stand for a massage, but I'm making sure that the pressure is upwards towards the spine and a light pressure downwards. I'm standing here for two reasons. Firstly, it's nice for the client to have a slightly different approach to a massage. It feels better, but also so that you can see well with the camera angle. You could see what I'm doing with my fingers here. I'm working in small circles each side of the spine, up inside the erector spinae, between the muscle and the spine. There is a beautiful natural channel there which should be clear of obstruction. An obstruction may appear in the form of crystals and tightness, spasm in the erector spinae muscle, but it also can appear in terms of a subluxation or a fixation of the vertebra themselves. This can be rectified with a core therapy treatment, and if I find something like that, I will always recommend the best course of action to the client. Now I've got double hands, one on top of the other, massaging slowly and firmly. Always the firm application up towards the heart. It's really nice over the scapula. And these are 6 circles. So 2 on the scapula, 2 on the sides of the body, and 2 over the hip points and the gluteals. So working around the hips, this feels so nice to receive. Funnily enough, especially with a double-handed approach. I think the reason for that is that the client feels that there is a solid application, that there is a confidence in the movement, that they only have to put their focus of where the massage is going in one place. Now returning to an effleurage stroke, solidly up the back, gently down the sides, and having warmed up the back with various techniques so far, I'm able to apply a little more pressure this time. I'm going to leave you to listen to the percussion movements of the hacking and cupping. These techniques boost the blood circulation, stimulate the lymph circulation, activate the nerve endings, are so good for the whole body health, the organs and the skin. Having given Katie some beautiful percussion move, she now is completely relaxed. It's interesting that such deep, fast techniques that have quite an audible effect while lying on the couch seem to have the opposite effect on the relaxation. We go into a very deep state once we have received a Swedish massage. Yes, it does work deeper on the muscles. There are noises, activity working its way around the body. But actually, it seems to soothe the senses where we become gliding on a cloud of relaxation and serenity. It seems to rid ourselves of thoughts and stresses and strains, where all we can think about is the beautiful massage taking effect in order to send us to a beautiful place. Now I'm working on the very lower back at the sacrum. I'm using my thumbs separately over the hard plateau of the bones of the sacrum, which has soft tissue over the top of the flat bone. The sacrum is made up of 5 vertebrae fused together, which make up this triangular shape at the base of the spine, and it is connected to the iliac bones of the hips and the pubis symphysis cartilage joint at the front of the pelvis, and these areas make up the whole pelvic girdle. I'm now separating my hands across the pelvis and up the spine, encompassing, just like at the start of the treatment, the whole back, and then bringing myself to separate the hands by stretching the spine from its center, lengthening and anchoring. Working a little more into the pelvis, the waist, making sure the muscles are soft and loose each side of the spine, over the latissimus dorsi, the scapula, over the top of the shoulders to the deltoids. And now coming to the scissoring technique, where this is the first move of 2 parts, having agitated and stimulated the muscle over the top of the upper back, over the ribs, using the double-handed flat hands scissoring technique. I then am separating my fingers, starting at the side of the spine, the vertebrae, and bringing them slowly over the side of the ribs down to the edges of the back where the lymph nodes are mainly concentrated, and this will have the effect of agitating and then clearing any toxins pooling in the back, in the white blood cells. I use my fingers in a long row. Fingers are all together, and slowly and very superficially, meaning at the very surface of the skin layer, I bring the fingers down from the side of the spine over the arch of the ribs down to the side of the body. Care is taken here because the sides of the body can feel quite ticklish, and it's important to be sensitive, not to use that ticklish effect, but simply work slowly and definitely, so there is no tickling technique used, but simply working with solid hands over the ribs. Now working at the waist level, and this is a wave-like motion, starting at the pelvis, overlapping one hand and then the other, coming from the side of the vertebra, the spine, outwards, working upwards, working over one side and then the other. And now working around the pelvis, up the spine for a last effleurage. Before I come back to the central position, using my thumbs up each side of the back, the spine, into the neck area. If I find an area that needs more attention, there seem to be a little muscle spasm on the upper left side, then I will work a little bit more there in order to help melt that tension away by warming, working around the muscle that is in spasm until it disappears. Nice solid hands. The room and Katie's back are now beautifully warm. The couch is heated. There are warmed towels, and I'm just about to apply a beautiful warmed second towel to the upper back, which helps anchor the massage, the oils, and the feeling Katie has now. She was so relaxed. Please subscribe to see the next premiere of Katie's legs Swedish massage. Let's spread a little healing. Thanks, guys.